Hi artists. Today we're going to be talking about the jaw. So here, let's talk about what actually makes up the TMJ. So on the skull, we have many bones that come together to make the skull, but the one that we are interested in today is the temporal bone. So the temporal bone is right here. And then this is the mandible, and this is the angle of the mandible, so that pointy part right here. And if you follow that pointy part up to this area, you'll see that there's a little divot behind it, and that is the little auditory meatus. That's the little hole that is placed for your ear. And then right in front, if you stick your finger right in front of that ear and you open and close, you will be feeling the condyle of the mandible that's right here. So temporal mandibular joint is the TMJ. Okay, so if you came to get evaluated in the clinic and I found that I didn't need to refer you to a TMJ specialist and that it looks like a lot of the work that you need is soft tissue work and some strengthening around these muscles of the jaw, then what I would often start with is doing soft tissue work for the temporalis here, doing some soft tissue work for the muscles in the masseter for the cheek. And then I would put a glove on and actually have patients slightly open their jaw so that I could get between the teeth. And that's how I get in and I'm able to work on these muscles that are really deep inside. So if you see here, if I can stick my finger through, then I can access those muscles from inside right next to your cheek. So one of the things that I send a lot of artists home with is self-stretches for the muscles of the temporalis and the masseter to help relieve some of the TMJ pain. However, it's really important that you know which muscles you want to be stretching and which muscles you want to be strengthening, because a lot of times one of the issues with the jaw is that there is an asymmetry that we're trying to bring into a pattern that will work a little bit better. So we wouldn't necessarily want to work both sides completely evenly if that was the case. But a lot of times if you just push into your temporalis and then up to the ceiling and open your jaw, you can stretch those muscles. And then here in the cheek, you can push up towards the ceiling and open your jaw to stretch those two. All right, artists, so last but not least, with TMJ, once we have evaluated, we know what muscles we want to be doing soft tissue work for, we know what areas we want to be stretching, then a lot of times I'll also include some strengthening exercises, because there's often asymmetries either side to side or forward and back that are causing some of the stress in the jaw. So this is the part where you really have to know which muscles you want to be adding strength to bring the jaw into more symmetry. But let's say that when you open, you were tracking to the right, then you could open gently and start pushing to the left for 3 counts. 1, 2, 3. And release. And something even as simple as that could start giving more strength to one area and stretching the other to bring more symmetry to the jaw. We can do that forward and back and side to side.